Hello friends, if you are watching this video, I'm certain that someone you know of has been prescribed Imatinib. And I'm sure that you are wondering, what is Imatinib? How does it work? What is it being used for? How can I give it to a child? Etc. Let me walk you through Imatinib and the important points about giving Imatinib to the child. I'm Dr. Swati Kanakia, Pediatric Hematologist-Oncologist from Mumbai. So what is Imatinib? It is an anti-cancer medicine. It is called as targeted. It is called as a targeted medicine. The reason is that the regular chemotherapy agents, they act on all cells of the body, including the normal cells as well as the cancer cells. However, in targeted therapy or targeted medicines will act only on the cancer cells. They might affect a few cells as well, but it is pretty precise, and therefore it is called as a targeted medicine. So how does Imatinib really act? It blocks a chemical messenger called as the tyrosine kinase. It's called as a tyrosine kinase inhibitor. Now this chemical messenger, the tyrosine kinase, it makes the cells proliferate, means they keep dividing uncontrollably, leading to cancer. This medicine acts against this chemical messenger and therefore stops the division and the progression of the cancer, and sometimes is able to stop it completely. So where all is Imatinib used? It's commonly used in chronic myeloid leukemia. It is also used in an acute leukemia where there is something called as the Philadelphia chromosome. It can technically be used in any cancer which happens because of the tyrosine kinase pathway. How is Imatinib given to a child? So please remember that it has to be given with a large glass of water. Also, the child should be in an upright, means in a sitting position when the medicine is administered. It can be given any time of the day. The dose will be determined by the doctor depending upon the height, weight and the body surface area, and also depending upon the disease for which we are using it. The commonest question: what are the side effects that I can expect after giving Imatinib? So all the three cell lines, that means the WBCs, can get low or become less, because of which the child is at an increased risk for infections. If the platelets are low, there may be chances of bleeding, and if the RBCs or the red blood cells are low, there could be anemia, and we have to watch out for symptoms of pallor, tiredness, fever and bleeding. In addition to that, there could be body ache, there could be fatigue, the child may feel exceedingly tired. There could also be GI problems like nausea, vomiting, there could be diarrhea. But all of these can be controlled by medicines. In addition to that, children are growing organisms, and this medicine is known to slow the growth of the child. Skin rashes is also something that we see in children receiving Imatinib. So what are the precautions that a parent should take while giving Imatinib to a child? Always administer Imatinib regularly and daily in the dose prescribed by the doctor. If you miss a dose, don't double the dose and give it. You could kind of catch up with it on the next day. Please ensure that the child doesn't receive any live vaccines, because vaccines which are actually meant to prevent disease in normal children can lead to disease in the immunocompromised child receiving medicines like Imatinib. Also, avoid contact with any other child who has received a live vaccine, for example, oral polio, which is commonly given in our country. In addition to that, be very careful. If there is anything different from normal, please report to your doctor immediately. With Imatinib, we have come a very long way. From IV chemotherapy given to small children to an oral medicine which can be taken safely at home with very few side effects. So friends, I'm very certain that your loved one will do well. Also remember that this is only an educational initiative. This cannot replace a consultation with your doctor. So please be in touch with your doctor at all times. Thank you so much for watching. If it was useful, please share it with somebody you know who can benefit from it.